I'm Daniel Levine, and this is the Bio Report. With the rapid advances in cancer research, it can be difficult for physicians to stay on top of all of the emerging treatments in clinical development. Leal Health has developed an AI-powered platform that provides a personalized list of treatment options to match a patient's precise diagnosis to advanced therapies and clinical testing. We spoke to Tzvia Bader, co-founder and CEO of Leal Health, about her own experience with cancer, how that led to the creation of Leal Health, and how it's harnessing AI to connect patients to clinical trials based on their exact diagnoses. Tzvia, thanks for joining us.
Thanks, Danny. I'm happy to be here today. Thanks for having me.
We're going to talk about cancer care, Leal Health, and how Leal's using AI to help patients get access to advanced therapies through clinical trials. I'd like to start with how you became involved in the area, beginning with your experience with your mother, who you lost to non-Hodgkin's lymphoma. What happened?
So, my mom was doing really well, and then at the age of 52, she started not to feeling too well, but nothing significant. She started to be a little bit tired. She started having weird rashes. She had several meetings with different specialists, and they all just told her, well, you're getting a little bit older at 52, right? You're going through menopause. You need to rest more, work less, and everything will be okay. So basically, they brushed her off. Eventually, she ended up with a great gyno who decided to take a more serious look into her complaints. At that point, she was diagnosed with non-Hodgkin's lymphoma, B-cell, stage 3C. And the funny thing is, but when we received the diagnosis, we were told, you're lucky. We thought it's worse, that it might be uterine cancer. So you're going to have a rough year, but you'll come out of it fine, and you can continue your life, which was fair enough because standard of care, the chemo protocol work at 70-80% of the cases, but unlucky to my mom, she did not respond well to the standard of care. At that time, basically, I reached out to her doctor and said, okay, so what's next? And she looked at me, and, that was in 1999. So internet just started, and I was already in computer and a little bit of a geek. And she said, look, I'm going to ask around in my colleagues, but if you can go to your internet thing and do a search and see what you come up with, that would be great. Maybe there's something out there. Which was very untypical to an oncologist to say something like that. And I do appreciate her for being candid about the fact that she has limited access to advanced treatment options. So I did my thing and I searched, and I actually found a clinical trial in Memorial that seems to be right for my mom. And I shared it with the oncologist. She really loved it. She reached out to the oncologist in Memorial. And we already were in a process of signing her up, but then her condition deteriorated really, really quickly, and and she had metastatic in the brain, and within 48 hours, we lost her.
In 2013, you were given your own diagnosis of malignant melanoma. This was about 20 years after your mother's battle with cancer. How had the world changed, and what did you do based on your experience with your mother that was different?
So when I got my diagnosis, again, stage 4, but melanoma this time, I knew I need to have a different outcome than my mom. My youngest was 1 year old at the time. My oldest was 5. I definitely needed a different outcome. And internet was different, right? We had our internet and we all became part of this digital world. And I, working in the tech industry, was part of a lot of tools that were about empowering us and changing our habit and the way we do banking and the way we do insurance, moving them all into the digital platform. So when I received my diagnosis, I was like, okay, let me look online. Let me to start from the online options, not wait for the oncologist to offer them, see what their options are, and then find the oncologist that fits me and decide how I want to get treated. And when I did it, I realized something amazing on the one hand and disturbing on the other hand. So the amazing part was that there was so many treatment options. Most of them did not exist. When my mom was diagnosed, there was so much innovation into clinical trial, which is extremely important in indication like melanoma, where the standard of care is not really working. But it's important for everyone, because even when standard of care, which means the approved chemo, works, as we know, it has very severe side effects. It's very hard to tolerate to a lot of patients, even if they respond. It's hard to maintain good balance with maintaining your life, taking care of your family, your work, while being on those treatments. So I saw a lot of innovation in targeted therapy and immunotherapy, different and new approaches to try and treat cancer on the one hand. On the other hand, I realized that, I don't understand any of it. So still as a patient, I don't have easy access to it, because I can find it, I can see there's option, but understanding, are those options are right for me? It goes through a list of what it's called eligibility criteria. So it's a lot of criteria that talks about your medical profile as a patient and say whether this treatment is right for you or wrong. So it could be an inclusion criteria, an exclusion criteria, but it's all in a very complex medical language. It's complex criteria. So you're not really sure, because of the complexity, because of the medical lingo. As a patient, it's hard to understand if it's right for you or not. And then when you go with a long list to the oncologist, the usual response is, no, those are not right for you. This is Dr. Google. Let me tell you what's right. So you sort of start going in a limbo and being completely dependent on what your own oncologist is saying. So in my own journey, I started in one community clinic not far from where I was living, as a majority of the patients. I waited 3 hours to meet this oncologist after trying online and seeing that I don't have a lot of success, but I had some questions, right? I saw some things. I wanted to better understand them. He spent 5 minutes with me, looked at me and said, well, you're not doing too good. Well, thank you. That's words of encouragement. Thanks for making me feel a hell lot better. But let's see if it didn't metastasize to your brain yet. And I was just like, alert. I know about brain metastatic. I lost my mom. That doesn't sound good either. So come back after that, and then we will see what are your options. Maybe I have one clinical trial. And I was looking at him, and I was just like, whoa, wait a minute. What do you mean, then we will see what are my options? What are my options if I have it in the brain? If I don't, why only one clinical trial? I saw so many other options. And he basically, fair enough, because, as I was waiting 3 hours outside, he had a long list of other patients waiting for him. But basically said, okay, I will talk to you when you come back. So I looked at my husband. I was just like, I'm not staying here. And he was terrified. He was like, he said, you're not doing well. We're not changing doctors now. And I was, okay, if there's one thing I've learned from my mother, losing my mother, is that I need to own it and I need to manage it. And I need to have a doctor that gives me option. I need to be in a place that I have option. Not having option is not an option. Not being on top of it is not an option. So that kind of started my journey. I moved to another very large research hospital where I met this lovely oncologist that suddenly gave me option. But even then, it wasn't simple. So he gave me 3 options. I started the treatment. The treatment didn't work for me. It was a clinical trial, actually, a very promising one. But as life goes, and in cancer especially, I did not respond to that treatment. So 7 months later, we had to reassess and make another decision of another treatment, which is how it goes with cancer. And when I came to him to see other option, I did what I said I will do. I went online, I studied, I then searched for help. I asked who can help me understand what I'm seeing. And I came to him with a few options I found. And there was one option it didn't even offer me. And I asked him a simple question. Are you offering me everything that is out there and just giving me the best based on your opinion and experience? Because you are the best or one of the best in your areas. And of course, you know a lot about the disease, about the melanoma. And he gave me a very candid answer. He said, I can only offer you what's in this hospital and what I'm aware of. So you suddenly realize how limited this world is. Even if you go to the best of places with the best of doctors, you're still getting a limited option list, which is, you guys can understand, and then you as well. But I told you already, I'm not happy with limited. I want to make a choice based on understanding all my options and then choose what's right for me.
How did these experiences lead to the formation of Leal Health? What was the vision for the company?
So the last statement I just gave was exactly that. I was like, every patient at any given point needs to better understand his entire option. Not only him, by the way, also his oncologist. The question should never be what's out there, what are my options. The question and what patient should focus on is what is right for me. I want a more aggressive treatment, a less aggressive treatment. I want to be treated close to home. I'm willing to travel far for the most innovative treatment. I want something with a lot of data proof. I don't care, experiment on something if I know that it might have a better outcome. There's a lot. I can tolerate pain. I can't tolerate pain. I want needles. I want pills. There's a lot to be discussed, but those discussions can only happen if I have option. And every patient, doesn't matter where he's being treated, who's his oncologist, what is his health insurance look like, should have access to all treatment. We need to democratize access to treatment, especially in a disease like cancer, and especially in a disease that there is so much innovation into. So that's kind of what drives the mission behind Leal. Think about it like a Zilor. Our mission is that you don't ask what's out there, you see immediately what's out there, and then you start focusing on what's right for you. But it was very clear to us from day one that the reason that something like that does not exist is because it's not a simple task. You not only need to have access to all the treatment, right? I need to have a very smart machine that can analyze it and, like an oncologist, understand the match between a patient medical profile and the treatment profile. So, because I only want to show you what's really right for you, not just stuff that are in the peripheral area, because that's not going to help you. And I need a machine that can understand medical lingo, and then I need to also help translate it to a patient lingo. So I need to, in a matter of minutes or seconds, actually find you the right treatment, match you to the right treatment, and help you understand that. So it's a very, very complex task for a machine.
You're using an AI platform to do this. What's it able to do that a patient or their doctor couldn't do on their own by going to clinicaltrials.gov?
So everything that a machine does, usually a human can do, right? But it's a matter of time and cost and knowledge. So what the AI can do, it goes into clinicaltrials.gov. By the way, now we do more than clinicaltrials.gov, because now we can also show you approved drugs, not just the clinical trials. But it can go into there, read through all the different treatment protocols that exist. So let's not assume I have melanoma, metastatic malignant melanoma. The machine can go through all the protocols for malignant melanoma treatment. He can understand all the eligibility criteria for all their complexity. Is it inclusion, exclusion? It's looking for a specific biomarker. It's looking for patients who receive the treatment until a certain point, who suffer from a specific side effect. So really understand the medical lingo, understand the complexity of the eligibility criteria, and then do the match to the medical profile of the patient. So usually if you take an oncologist and you ask him, if you go to clinicaltrials.gov and you come through that, for one patient, it will take him 24 or 48 hours, depends on the profile of the patient. So it's a long time. And for a patient, it will take a week or even more. And again, the patient will have problem understanding some of the medical lingo, probably. And then, so he can read through all of them, can create this match immediately. And then also, for the sake of the patient, it not only show you the list of treatment that are right for you, it will rate them for you. And that's also for the oncologist based on the guidelines, right? So if it's a targeted, it could be better for a patient than a general chemo. If it's a combo, could be better from a mono. So there's some guidelines to how you rate it. And we rate it based on that. And we also curate it for patient-friendly language. So a patient can understand what is this treatment, what type of treatment it is. It's immunotherapy, a targeted therapy. What does it do? It's combining these two treatments. What is the expected outcome? How many cycles will I receive? How many times do I expect to go to the hospital to receive it? It's how would I receive it? If it's a trial, what is it measuring? What is the expected outcome out of it? So a lot of information. So the biggest task is actually doing the match and finding the right treatment. And then it's also curating it and helping a patient better understand these options.
How does it work? What information does a patient or their physician need to apply? And what's the input? What's the process and what's the output?
Okay, great question. So basically, in order to do the right match, it's like when you go to a doctor office and there is the intake forms that we all love so much. But it's a necessity, right? If I want to find you the right treatment, I need to know as much as I can about you. So we need a patient to come in, and we basically are a physician on his behalf, and we take him through a dynamic questionnaire that asks him question regarding his disease characteristic, what type, subtype, if he's done NGS testing, biomarker, genetic mutation, etc. We're looking at treatment history, what treatment he received, what was the outcome for him. We're looking at other health condition. Now, all of it is done via dynamic questionnaire. And as always, if a patient doesn't know, he can skip. And then basically we will tell him, those treatments we know are precise for you based on the information you gave us. Those treatments could possibly be right for you, but we are lacking this specific information. Once you added it, we can know if it's right for you or not. And of course, exclude those that we know are not right for him. Now, one of the things that we're doing, and I'm sure, Danny, that you probably already heard a lot about Gen AI, and there are people here talking about Gen AI. So Gen AI now allows us to be more precise and also better support the patient in their journey. So we know, for example, NGS, next generation sequencing reports, which are basically genetic testing reports, are very hard for a patient a lot of time to understand. So we allow them to upload those, and the machine reads and pre-populate them. We're now in the process of actually working on allowing patients, probably in the next few months, you will see it, add more and more documents to upload, and we will create this information and just ask you supplementary question about the things that are missing. So we're building as a holistic and as complete profile of the patient current disease and medical condition. And the output from it will be the list of clinical trials, and now we're adding also approved drugs that are right for you. So like I said, those that you meet the eligibility criteria, not those that are in the peripheral area or could be, but actually the ones that are precisely right for you, with as much information as we can give you around them. Which is information that are really important to patient. How many cycles, how they're giving, for how long. When we talk about the approved drugs, we even can give patient data around how other patients who receive those treatments rate them, aggressive, less aggressive, what other side effect patient that receive those experience. We can show you if a trial is completely novel therapy or taking novel therapy and combining it with already approved therapy. If it's a trial for a drug that was approved on another indication, we can share some data around. We see it a lot now that, a new drug will be tested on melanoma and then tested for lung cancer patients. So we can share data about the melanoma patient. How did they experience it? What was the success rate with it? Side effect, again, aggressiveness level, etc.
Is this available to any cancer patient, or is it only available for patients with a particular type of cancer?
Great question. So it's available to almost all cancer types. We are now covering over 22 cancer type, which covers 95% of the cancer, 93% of the cancer patient population. And we're working and adding new in the cancer type every month or so. The reason there is a little bit of a gap or it works this way is mainly because we need to train the system, right? AI, I refer to it usually as a she because it's smart, so there has to be a woman. But jokes aside, it has to be trained because I don't want to give a patient a list that will be full of things that are not right for him, right? The quality will not be right. And so we need the precision here. The accuracy level is really important to us. So we spend a lot of time QAing the outcome and the output from the machine. And only when we get to the level of accuracy we feel comfortable, we release it to patient to be used.
Clinical trials in cancer are a dynamic area. Do patients get a one-time result, or are they made aware of potential new treatments as additional clinical trials are initiated?
It's a really good question, and I think also we're lucky that it's a dynamic area, right? We're lucky. I always said that I'm lucky to be diagnosed at the time I was diagnosed because the prognosis for me was not great, less than 40% survival, and the fact that I ended up participating in 3 clinical trials probably saved my life. So that dynamic, that new additional trials are being added on a weekly basis is a great thing for patient, and that's why using Leal is not a one-time thing. So we keep every time there's a new trial that is added and fit the patient profile or a treatment get approved, we notify the patient. So a patient will always receive the new email from us letting them know there is a new trial, a new treatment option that is available to them that wasn't available before. So they can evaluate them and their doctor and see if that's the right time for them to try it. We also encourage patients every time, even if you choose to pass and start a different treatment, keep your profile updated. So if this, in the worst case scenario that the treatment doesn't work, you immediately know and have other option available for you. One of the interesting, can I say one more thing, Danny?
Sure.
About things that we were working now to help patients in the future. So one of the things we're even working now is to help you plan ahead your treatment plan. And what do I mean by that? A lot of the time, if I'll do one treatment, it will eliminate additional treatment in the future, or it'll be added as an exclusion in treatment and the clinical trial. So we're now working and developing this new capability that will allow patients to not only see their current option, but also see a what-if scenario. So understand each treatment choices, if they started, what treatment will not be available for them in the future or will be available. So you can really plan ahead smartly when you look at your journey for cure.
This is a service that's free to use to patients. What's the business model? How does Leal make its money? And is there a way to leverage the data, which I suspect could have a lot of value?
It's exactly that. You're spot on. It's absolutely free for patient and will be. And that was a core value for us for day one, because we don't want to take from patient. Patients are going through so much. This should be the last thing that they pay for is information about treatment that are available for them. The way we monetize that is via the pharmaceutical company. The pharmaceutical company are the ones who are looking for patients for their treatment, for their clinical trials, for their approved drugs. Not only they're looking for patients, they also are looking for data surrounding patients. They want to better understand. At the end of the day, patients are their consumers, right? And they need to serve patients better. They talk a lot about being patient-centric and focus on patient experience. But unfortunately, we live in a world where they don't have a lot of data surrounding those patients. And that's exactly what we do. So by meaning, I never give them personalized patient data. I give them analytic around patient data, so they can better understand where our patients are for their clinical trials. So instead of instead of them opening site and expect patient to come to them, they can know where the patient is and bring the trials closer to the patient. They understand the patient barriers. What are they concerned about? The side effects, the number of tested, the fact that the drugs is a mono versus a combo, the fact that it's not giving the fact that it's giving with the treatment you need to be hospitalized for a week or so. So there's different concerns and issues and barriers for a patient and different motivations. So we analyze those and we share it with the pharma so they can better utilize, better prepare, better plan, and better serve patients. And that's the way we monetize the data without compromising the service we give to patient, without asking patient to pay, but also with keeping patient completely anonymized and only their data is being served to better serve them.
I suspect you're familiar with the saying in the tech world, if you're not paying for it, you're not the customer, you are the product. What's the case that this shouldn't matter to patients? Why should they feel confident Leal's acting in their best interest?
Because at the end of the day, you're absolutely right. That's the statement. And we are leveraging their data to better, for the pharma to better serve them. But the way they can feel comfortable is for two holds. A, because at the end of the day, if we will not do right by patient, we will not give them all their treatment option. We will compromise the level of service they're getting from us. They will not come and they will not use us. So we will not exist if we don't do a good service to them. And I can give you a true example. We had early on when we were just starting to sell to pharmaceutical company, we had pharmaceutical company that came to us and said, okay, I'm willing to sign a contract for your service, but I want you to remove my competitors from the platform. And we looked at him and we say, we'll never do that. And he say, why? I said, because that's compromised the level of service I'm giving to patient. And that's a key value for me. I will never do it. I build this platform as a patient because I know what patient needs and to give them better option. I will not take those options away from them. And therefore we walked away from that deal. So it's our core mission. It's our drive. It's the reason we build it. So we will never compromise it. And it's also bad business. Because if we will, like I said, if we're not going to serve them right, they will go. I can give another example. We're working with a very large pharmaceutical company where they embedded us in their own website. But then we told them, what if you guys don't have anything to offer? You can't leave patients with no option when there are options out there. So now they agreed that even we're embedded in a pharmaceutical company website, if they don't have any offering for those patients, they allow patient and they propose patient to go directly to Leal, and it's in a one click to see other options. So it's a novel thought, but again, it's exactly the message we have for the industry. Let's put patient first. Let's focus on what the patient needs. And that's what drives us in our growth.
I suspect beyond that, there's this opportunity to get enormous visibility into the state of cancer and patient need. Are you able to leverage data in less obvious ways to do that?
Yes, absolutely. So, and it's very, very interesting because we provide patients so much value because also we engage with them in such intimate manner. We can see overall trends. We can see overall gaps in the industry and really help drive forward cancer care. From profile of patients that have no option, and we can raise a flag to we had an ASCO publication. ASCO is one of the largest oncology conferences in the world. We had a publication there where we took bladder cancer and we analyzed the eligibility criteria, and we saw that a lot of patients are getting excluded from trials for things that are temporary, because some of them are elderly patients. The first line of treatment is very hard and leave them feeling not too great. And because of that, a lot of them get excluded over eligibility criteria called ECOG from trials, but it's a temporary health situation, and over time they get better and stronger, and that should not be the case. So it's identifying where you're actually limiting patient in a large scale for something that should not be the case. It's not this a chronic medical condition, but a temporary one. So we can flag it to them. We can flag a lot of those trend changes. We can see also population that are more inclined to clinical trials, but then have less option. And we have this dialogue, ongoing dialogues with the pharmaceutical company and the industry, and we publish those data in order to really drive innovation in cancer care from the patient point of view.
How many patients have used the service to date, and is there any way you are able to track actual matches or outcomes?
We have already over 150,000 patients that have used our platform in the US. And absolutely, we track matches, and we see we see return user over time, and we see the journey. Unfortunately, patient and treatment is not one time off, right? For the lucky one, they get on a treatment, whether it's a standard of care or a clinical trial, it works for them, and it's the end of the story for them. For a lot of patients, it requires more than one type of therapy. There is a recurrence, and we track them over time, and we see them keep coming back, and we see the level of matches. Over 80% of the patients that will use the Leal platform will get matched to treatment option. And we see also the percentage of patients that are acting upon it and enrolling to clinical trial, which is significantly higher than industry standard, which is very, very encouraging as well.
Leal's raised nearly $30 million. It completed a $20 million Series A in February 2022. How far will existing funding take you, and what's the plan for raising additional capital?
Yes, that's the question of the decade, right, or the year, because 2022 and 23 have been a little bit more challenging for startups, especially on the digital health side. We're lucky as we leverage AI, and we're so innovative that we're in a different position in terms of fundraising. The funding lasts us to mid-24, second half of 24. We might do a raise before to expedite our growth, but we'll see.
Tzvia Bader, co-founder and CEO of Leal Health. Tzvia, thanks so much for your time today.
Thank you, Danny. It was such a pleasure speaking with you today.
Thanks for listening. The Bio Report is a production of the Levine Media Group. To automatically download this podcast each week, subscribe to our RSS feed or through iTunes or other podcast manager. To join our mailing list, go to levinemediagroup.com. We'd love to hear from you. If you want to drop us a line or are interested in sponsoring this podcast, send an email to danny@levinemediagroup.com. Special thanks to Jonah Levine, who composed our theme music, and the Jonah Levine Collective, which performs it.